A lot of you have been told that your acid reflux is because your stomach is making too much acid. And that certainly makes sense when you're having that terrible burning in your chest, the classic heartburn, or worse yet, you're spitting up acid. It certainly seems like an excess acid problem. However, there is a facet of acid reflux that you really need to understand. Rarely is it too much acid. There can be other causes, but I want to focus today on something that most people don't discuss, and that's too little acid. So your stomach is designed to be a bag of acid. That is its job. Yet if you have been on a PPI medication, which is of course dramatically decreasing the amount of acid in your stomach, or you're just getting older, because with age we tend to produce less acid, both of these scenarios can result in insufficient acid, and then this is the mechanism that occurs. So you don't have enough acid, and food then kind of sits in your stomach. It's just fermenting, it's producing gas. As a result of that, you can feel full very quickly, you can have belching, you can have gas, distension. It's a pretty miserable feeling, and with that, pressure builds up. So with the pressure, the stomach is forced upwards, which is the definition of a hiatal hernia. The stomach is brought up above the level of the diaphragm. Your stomach should be nicely below your diaphragm, but when it gets pushed up, then it comes above the diaphragm. And when that happens, there's a protective mechanism that your esophagus has to make sure that food and drink goes only one direction, top down, and that includes the contents of your stomach, whether it's food or acid. And it's a sphincter, or a valve, and there's one in the upper esophagus, there's one in the lower esophagus. We're going to talk about the lower. That is abbreviated to LES, lower esophageal sphincter. And with normal anatomy, there's the diaphragm, there's your stomach, and just above the stomach, at the base of the esophagus, is that lower esophageal sphincter. And it is designed, as I said, to have a nice tone to it. And other than when you're swallowing something, then it of course opens up, but then it stays nicely closed. One point to notice is that it requires acid, so this lower esophageal sphincter, in order to retain its tone so that things don't go in the wrong direction, it needs acid to do that. There's other factors that affect it as well. We're just focusing on the acid right now. So when you have decreased acid, you have decreased tone of the sphincter. It's kind of floppy and lying open, and then of course it's easy for acid to come back up. Now, you're saying, but wait a second, I don't have enough acid. It's true. In the getting older scenario, being on a PPI drug scenario, you have decreased acid, but it doesn't take much. With that lower esophageal sphincter kind of flabby and flopping open, it doesn't take much acid to come up because there's still some present. And that's enough to irritate your esophagus and create reflux symptoms of the burning that's so classic. So then of course you go to your doctor and he or she says, oh, you have reflux, pretty classic, here's your PPI medication, which is only exacerbating the condition. And that's something that is very important to understand. PPI drugs have a terrific number of dangerous side effects. They include infections, osteoporosis, weakened bones, kidney disease, risk of heart attack and stroke, risk of dementia. It is a long list. Stomach cancer. So it's a long list, and I talk about it in several videos if you want to look them up. But the point here is that a lot of people are being medicated with something when the exact opposite problem is occurring. There's not enough acid. What else do I want to tell you? Yeah, so the bloating, the belching, the feeling full right away, those are symptoms of not enough acid. They can also be just symptoms of hiatal hernia syndrome. So I don't want you to jump to treating yourself, and I'm not recommending treatment here because I don't know you. We need to know your health history and see what's appropriate. But ruling out an H. pylori, Helicobacter pylori infection is important because that will diminish the amount of acid in your stomach. Also, trialing with supervision. So I'm not telling you to do this, I want to be perfectly clear. But with supervision, you can trial betaine hydrochloric acid that you would take just before a meal and see how you do. I'm saying with supervision because if you really do have a stomach ulcer or esophageal ulcer, that can make you pretty miserable, and it could be dangerous depending on the severity of your situation. So I'm just giving you ideas of what treatment options are available, but it's with supervision, and we really need to know your health history. I think the important thing I wanted to communicate is that this is a very common scenario to not have enough acid in your stomach, and in a very counterintuitive way, it mimics having too much, which is that, the classic heartburn, the classic reflux. So we're all about root cause here, and that is what's happening. What is the root cause problem? Is it not enough stomach acid and the food is just putrefying in your stomach and creating gas? Is it something outside? Because pressure can happen on the stomach from the outside, kind of squeezing the stomach, or the stomach itself can have too much gas, and that pressure, that is from within. So it can be from without, it can be from within. That's what we have to discern. It could be both, but that's where sort of the meticulous, comprehensive look at how you got there is so vital to you regaining your health as you well deserve. So if you are frustrated with reflux, if you've been on a PPI medication and you're not sure if it's right for you, or you really want to see if you can get off of it, we are here for you. You definitely deserve to know the side effects of PPIs, and I'm also not suggesting you just stop them, because that can give you a rebound acid production that literally is too high. So I'm not suggesting that either. It's got to be with supervision, with someone who really understands how to do this. But if you'd like help, as I said, we're here for you. That's what we specialize in, and you can call us for a consultation. But I hope this information was valuable to you. It's a kind of a side of things that's not often looked at, but very valid and very true. So if you like this information, please give it a thumbs up. Consider subscribing to the channel. We're really trying to increase our subscribers because that's how the algorithm works, so that more people can see these videos and get help from them. That's my sole purpose, and I do appreciate you very much. I answer most of the comments I get, so we'll talk soon.